Welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. We have two guests today. We have Dr. Meghan Milburn, and she's a breast surgeon. We also have Jacqueline Beale. She's with an organization called Hope Connections. And today we're talking, ladies, about the fact that a lot of young African-American women are getting breast cancer at a rate that it hasn't been in years past. So welcome first.
Thank you so much for inviting us.
Thank you for having us.
So let's start off with Jacqueline. Tell us about Hope Connection and what you're doing now to deal with the situation, the fact that more and more young African-American women are getting this disease.
Thank you, Stephanie. So Hope Connections for Cancer Support is a nonprofit that was established almost 13 years ago, primarily in Bethesda, and by two co-founders who had family members that were diagnosed with a form of cancer. We expanded, I'm delighted to say, our footprint in Prince George's County in October 2016. And since then, we've opened our doors and we're offering our programs and services. And just to tell you unique things first about Hope Connections for Cancer Support. One, all of our programs and services are provided free of charge. We donate all of our programs and services, and yes, I said free. And some of those programs and services are support groups. They are what we call mind-body programs, where we provide yoga, Pilates, strength and weight training. We also provide educational workshops to keep our participants, as we call them, abreast of everything that's going on.
So tell us about this new program.
So we have a new program that we stood up specifically for young African-American women that are being diagnosed with breast cancer. We had one of our medical advisory board members come to us and say, I'm seeing patients as young as in their 20s being diagnosed with breast cancer, and sometimes the cancer is the aggressive type. Can you do something? And we said absolutely. So we went to the Prince George's County Council, who graciously funded us and provided us a grant to specifically stand up their program. It is in place now. We stood it up last October, and we're delighted to say that we are seeing participants taking advantage of the programs and services.
And Dr. Milburn, who's with Anne Arundel Medical Center,
Yes.
What got you guys involved with this?
Well, just our patients. We are so excited to be able to partner with Jacqueline and Hope Connections in order to offer this fantastic support to our patients, because younger women with breast cancer face a whole host of issues that many of the other breast cancer patients don't face. Young women are often dealing with children, or perhaps even starting about thinking of families, so there's the whole fertility issue. And they also have careers, very different than someone who's, say, in her 60s or 70s. So this was really a fantastic program to get these women together, for them to offer support to each other.
So what have you been seeing? What do you believe are some of the causes of this?
So we know that breast cancer is one of the most common cancers in women here in the U.S. and also in the world. In this particular area, African American women do seem to be getting breast cancer and at risk for this at a younger age. Certainly some of the risk factors are family history of breast cancer, family history of some other cancers like ovarian cancer, pancreatic cancer. Obviously, some of the genetic mutations, BRCA1, BRCA2 are a few that can significantly increase the risk. We also know that just lifestyle factors such as being overweight, not exercising, smoking, consuming alcohol, all of these things can significantly increase your risk of breast cancer.
You mentioned weight. What is the connection there? How our bodies process estrogen? What is it?
Exactly. So we know that women who are overweight or obese, those fat cells are actually very active and they make estrogen. And we know that increased levels of estrogen contribute to the risk of breast cancer. So basically, the heavier you are, the higher your level of estrogen, and then the higher your risk of breast cancer. But the good news is that the converse is true. So by losing weight and getting to a healthy weight, you can actually decrease your risk of breast cancer.
How about alcohol? Why is alcohol a factor?
So that is because in the body, alcohol mimics the effect of estrogen as well.
And so
again, that can increase your risk of breast cancer. Like anything else, it's all about balancing those risks and benefits. As we know that Alcohol is thought to have some cardiovascular protective effects, but what I like to tell my patients is really everything in moderation.
How do you let these women know that there is life after breast cancer, especially if you get breast cancer at a young age in your 20s, that you can go on to have your career, to have your family, to have a life?
Sure, absolutely. Well, one of the things we offer both at the AAMC Bowie office as well as the Fortney Breast Center are our wonderful patient nurse navigators. They reach out to all of the patients, offer a lot of support, and then also we have many different support groups.
We were talking about there being life after breast cancer, going on to have your family, your career, living the life that you always thought you were going to live. What kind of services do you provide to get women there?
Right, so we have a fantastic group of people, everyone from the front desk through our nurse navigators, our surgeons, everyone there is to help patients through this long journey. And oftentimes it is a lifetime journey because usually a cancer diagnosis will affect you for the rest of your life. Both at the AAMC Bowie Clinic as well as the Fortney Breast Center in Annapolis, we have fantastic patient navigators that are available for our patients to reach out to all the time. Plus we have survivors that offer support and then also support groups. And I think one of the most important things for women, no matter their age, is the support from other people who've been through this journey before and can learn and see that there is hope and there is healing.
If you have breast cancer in your family, maybe your mother and your grandmother, how soon should you start getting tested?
So that's a very complex answer. One of the most important things is really to have that discussion with your doctor. There are many different guidelines out there as far as when to start your mammogram. Some advocate starting at age 40, some at age 50, many in between. Again, this is something that needs to be discussed and really personalized. If you have early breast cancer in your family, anything before age 50, then you should be getting mammograms starting 10 years. So let's say if your mom had breast cancer at 45, you should probably begin screening mammograms at age 35. But I also want you to come see me so we can discuss your risk. And then I also have a high-risk clinic if you are at increased risk, because it's not inevitable that you will get breast cancer. There are some things that we can do to significantly decrease your risk of breast cancer. And if you do develop it, there's some things we can do to catch it very early.
What are some of those things that you can do to decrease your risk?
So most of it is really healthy lifestyle.
Okay.
So exercise, you want to be active, you want to maintain a healthy weight, you want to eat a healthy diet, don't smoke. That's a huge cancer-causing risk factor for across the board, almost every cancer. Limit alcohol. And then know your family history, because if there's a lot of cancer in your family, especially breast or ovarian, your family might have a genetic mutation that significantly increases the risk of breast cancer. If that's the case, we can get you tested and your other family members tested. And if you do have the mutation, there's some things we can do to significantly decrease your risk.
How successful is the testing nowadays?
So the testing, when you go through an accredited laboratory, is very successful. I know there are some of the over-the-counter tests that have been getting a lot of press now that people use. For the genes that they test for, they're very accurate, but usually they only test for 1 or 2 cancer genes. If you meet with a genetic counselor or meet with your physician and have a genetic test ordered, these test for multiple different cancer genes, and we're more likely to find something.
Because we say it's all breast cancer, but there are different types of breast cancer?
Yes, yes. There are different types. There are obviously more aggressive types. Some of those can occur in young women, certainly at any age, but oftentimes more so in younger women. There are the more indolent, typical postmenopausal type of breast cancers that occur usually in older women. And then there are also other cancers that can be linked in the family, such as ovarian cancer, pancreatic cancer, prostate cancer as well.
When you're checking yourself, what should you look for?
So you want to be able to know what your normal is and recognize a change. And it's not just feeling for lumps, but it's also noticing The skin, is the skin reddened or thickened? Has it changed? Has one breast suddenly become very swollen or larger? Has the nipple changed or inverted or turned inside out? These can all be signs of breast cancer. They can also be signs of benign disease, but these are things you need to get checked out.
What about if a woman has dense breasts?
So dense breasts are nothing to be afraid of. Many women, especially younger women, have very dense breasts.
And what does that mean to have dense breasts?
So what that means is when we look at your mammogram, the dense breast tissue looks very whited out. So the concern is that it could mask an underlying cancer. But now with our 3D mammography, also called tomosynthesis, this technology is even better at looking through dense breast tissue and searching out any cancers.
And I'm glad you said that it's not just doing the mammogram test that we kind of grew up hearing about, that there's other things that you should absolutely look for when you're checking yourself.
Sure.
And how soon should you go in? Because sometimes women will say, oh, that's nothing. How do you know it's something? Or is it just better to be safe than sorry?
Nothing wrong with being safe rather than sorry. I am more than happy to see 100 patients that the little lump turns out to be nothing other than just dense breast tissue, in order to catch the one patient that actually does have breast cancer. But, you know, call your doctor, get in, get seen. Sometimes we need imaging, sometimes we just want to wait a couple weeks, see what happens. You know, breast tissue is very lumpy, bumpy, which is just due to the underlying breast tissue as well as the effect of hormones.
What types of drugs now are available? Is there anything new that's coming out to help prevent a recurrence? Or
There are a lot of new drugs out there. You know, we always have new drugs coming out. Some of the mainstays that we use to help decrease the risk of breast cancer, and this is in women who are just at increased risk of breast cancer or at high risk. It's one of our oldie but goodie medications called tamoxifen, and it's a very safe medicine, very effective. When it's taken daily for 5 years, it actually decreases the risk of breast cancer by 50%, which is a big number. But to put that in perspective, if your lifetime risk of developing breast cancer is 20%, taking this medicine will drop that by 50% down to 10% lifetime risk. So it still makes a very significant difference for our patients.
We've seen over the years Hollywood stars like Angelina Jolie who got her breast removed completely to kind of prevent, because she's, of course, was at high risk.
Absolutely. And I think this is fantastic that a lot of celebrities are very open with their diagnosis and their treatment, because it helps get the word out. Angelina Jolie was diagnosed with one of the BRCA mutations, and what this does is this puts her at a very, very high lifetime risk of breast cancer, anywhere from 50 to 80%. Part of that depends on other cancers in the family. But she was very proactive and elected to have a prophylactic mastectomy, meaning that she had all of the underlying breast tissue removed in the hope of preventing breast cancer in the future. And we have some fantastic plastic surgeons that I have the privilege of working with that do beautiful reconstructions in all of our mastectomy patients, whether they have cancer or if they're having prophylactic mastectomies. Oftentimes we can now save the nipple, especially in patients that don't have cancer, where I don't have to worry about cancer right behind the nipple. This is often an option for them. And oftentimes they go in and come out of the operating room with a beautiful looking breast, and now they have significantly decreased their risk of breast cancer.
Jacqueline, you talked about how Hope Connection has, it just kind of brings a holistic approach.
It does. And I just want to say, I was listening to Dr. Milburn, and everything she talked about, I think I'm the classic case for all of it, because as you know, I'm a 2-time breast cancer survivor. So everything that you said, I think I've probably gone through as well, from the family history to making sure I could get tested at a younger age. And so thank you for sharing all that, especially especially to young women that are being diagnosed now.
And again, what age were you when you were diagnosed?
I was 39.
Okay.
But my mom was also in her 30s when she was diagnosed, and my grandmother was young when she was diagnosed as well. And I also had dense breast, and I also had, it was sort of a fight to get tested because the screening guidelines are, you know, extended, but because of my family history, I was able to do so. And so when you said the young women should be safe than sorry, they absolutely should be safe than sorry. And I totally agree. Again, know your body, because absent doing my breast examinations, I probably wouldn't have found it until much later, and the outcome could have been different. But Hope Connections, and I always say I wish it was around when I was diagnosed, because the support groups are absolutely wonderful. Oftentimes you have people say, you know, I know what you're going through, but unless you've been diagnosed with cancer, you really don't know what I'm going through. And so it's nice to be among people that actually have experienced that journey and walked in your shoes, if you will. And then Dr. Milburn talked about the benefits of a healthy lifestyle and exercise, and so we offer just that. We complement that by bringing in some of the exercise classes such as yoga, Pilates, strength and weight training, and then our educational workshops to continue to let people know about the benefits of healthy lifestyle. So we have nutrition.
How do you educate them?
We bring in, all of our programs and services are facilitated by licensed professionals, and we bring in experts to talk about certain things such as nutrition, or if you have some breast cancer patients that develop lymphedema, we bring in experts to talk about lymphedema. Anything, we don't shy away from anything. So if there's a topic, or if there are advancements in research, or discussions that we should have relative to cancer, and it's any form of cancer. I know we're talking about breast cancer here, but we open our doors to people who have been diagnosed with any form of cancer. And so we try to make sure we stay on top of what's going on relative to cancer, and bring that information to our participants.
And you know, I've had Dr. Regina Hampton
Yes.
on several times, and she has the breast boutique. And
Yes.
Yes.
we want to emphasize how important it is for women to still feel beautiful after the surgery. And of course, her store offers all types of products, and there are so many things available. And she brought some stuff in that it makes you look natural, like
Absolutely.
you're whole again.
Right, right. And that's such an important part of the breast cancer journey, because it's cancer, but it's very different than other cancers, because it really affects a woman's sense of self, her femininity, her outward appearance. So we really strive to take care of the patient as a whole. And my job, even though my job is to remove the cancer, it is very important, the cosmetic outcome, whether I'm the one doing the surgery or if I have the plastic surgeons coming and assisting me with the reconstruction. That's just as important as the cancer surgery.
And what are some of the successes that you've seen with women who have gone on to just live their lives as after breast cancer?
Oh, so many. I mean, everything from just women being able to go back and resume their normal life, if they're moms, taking care of their kids, if they have a career, going back to their normal career, moving on with their life. I've also seen some women with some very advanced breast cancers who are 5, 8, 10 years out doing extremely well.
And that's important to say, too.
That really is, yeah. And one of the reasons I like treating patients with breast cancer, why I do this, is because even though it can often be a devastating diagnosis, there's often a lot of hope. And most of the outcomes are very good. Our 5-year survival is extremely high. It's well above 95%. However, if you fall into that 5%, even if we don't have curable treatments for you, oftentimes there are treatments that can extend your time where the cancer is in remission or give you better quality of life.
That's what I was getting ready to say. What will your quality of life be at that point?
Mm-hmm. So most of the time, very, very good. And I think throughout this, oftentimes the most difficult part to hear as a patient is you're going to need chemotherapy. I think that's what really scares people the most. It's probably the toughest part of the journey.
Chemotherapy gets a real bad name.
Yes, yes, it does. And what I tell my patients is that the chemotherapy of today is different than even 5 years ago.
Really?
Yeah. We have new medications, we have new protocols. There are medicines now that really prevent nausea. Most women don't have a problem with nausea when they go through chemotherapy.
What about the hair loss?
So
that's what you always hear the most about, is the hair loss.
Yeah, so the hair loss is tough, but it grows back. And oftentimes it grows back curlier, at least in the beginning. But most insurance companies will cover hair pieces and wigs or headscarves. I do have some women that just rock the bald look and go with it. So it's very individualized.
I'm glad you mentioned that. Insurance companies also cover some of the...
they cover the prostheses, or at least a portion of it, as well as the bras. So that's definitely an option. You know, going through reconstruction, which oftentimes does involve additional surgery and sometimes a little bit longer recovery than just a mastectomy where no implant or anything is put under the skin, that's a great option for a lot of women. And then what they do is they will custom make a prosthesis that fits in a bra. That way you're nice and symmetric. You know, and they have special ones for bathing suits, for swimming, in addition to just regular clothes. So that can be a fantastic option as well.
How do you all help women kind of put that, or make them aware of what is available to them?
Well, thankfully, we have people like you that allow us to share who we are and what we do, but we go out into the community, and I like to say we don't leave any stone unturned. So we go out spreading the word. We go to corporations, we go to hospitals, to healthcare organizations, faith-based organizations. We go into the schools, I mean, even high schools and universities, because, you know, cancer, I like to say, is probably, we all are probably 1 degree away from someone we know.
Absolutely.
And so
I think all of us, I can sit here and name at least 3 or 4 close relatives who have dealt with one type of cancer or another.
So we try to talk to Stephanie, any and everyone, and share about the programs and services that we offer. And I'd like to mention, I know we talk a lot about the patient, but for Hope Connections for Cancer Support, our doors are also open to the caregivers, family, and friends, because we believe it takes a village of care.
It does.
So if you had a family member, you can take advantage of our programs and services as well, because guess what? They need support as well.
Exactly,
Absolutely.
because if you, especially if you're a mom, if mom is going through it, the whole family is going through it.
Exactly.
Oh, yeah.
And so we do that. And one other thing I'd like to share is there's no duration time, because cancer, just because you were diagnosed, let's say 5 years ago, and you're living your best life now, and you're healthy, happy, healed, and whole again, there could be some residual side effects, and maybe you still need the support or the mind-body programs. And so we don't have a duration. So
what do you feel is that mind-body connection when it comes to cancer?
I think it's for some people it's spiritual as well, and some people just feel great leaving out of just having a good time with people that have gone through what they're going to, taking some yoga or doing some line dancing or doing Pilates or something, knowing that, you know, I'm taking advantage of the programs, and I'm doing everything I can to help my body stay in a healthy state.
What do you feel is the mind-body connection, Dr. Milburn?
Well, I think it's very important. Whether you're diagnosed with cancer or not, you still have your life to live, and your entire world is not just cancer. There are deadlines at work and projects at school and time to spend with your spouse and your family, so life goes on. So I think it's very important to go through the treatments, but you also need to manage the side effects and live your life and enjoy it as much as you can. So that is very important as well.
And let's talk a little bit more about the side effects. We talked about feeling nauseous, maybe with the chemotherapy. We talked about hair loss. What are some of the other side effects?
So what I also talk to my patients about is the new normal, that we will get you through this, but it is going to be a new normal. And whether this is just due to scar tissue, whether they've had a mastectomy, reconstruction or not. Oftentimes the patients who've had lumpectomies, the small surgery, and they have radiation, that can change the texture of the skin. They can have more scar tissue. One of the big concerns is lymphedema, which is arm swelling. That can occur after you've had lymph node surgery or radiation, and this is something that can happen at any time. It can happen after surgery, it can happen a year later. It can even happen 20 years later. So it's something that our patients need to be aware of, and if they even think they're having a problem or starting to develop this, they need to get in and be seen by our lymphedema therapist to help manage this as well.
And I like the fact that you said your organization, whether you had breast cancer a year ago, whether it was 20 years ago, that you all are still available.
Absolutely, because as Dr. Milburn just said, lymphedema, for example, it could develop 20 years after you've been diagnosed. So our doors are open, because that could be, very emotional for a woman, especially a young woman, to develop lymphedema. So we want to make sure we're there to support everyone.
And I want to mention, as we wrap up the program one more time, the new program that you all have available.
We specifically designed a program for young African American women diagnosed with breast cancer. And what we've done, we've uniquely designed the programs differently to meet them at their need, where they are. So we have programs such as Create Your Own Floral Design. We have line dancing. We're doing a pink and purple brunch. We're partnering with University of Maryland Capital Regional Health, and we're doing an all shades pink. And we're partnering with Dr. Milburn at Anne Arundel Medical Center, Bowie, and we're doing We Are Wonder Woman.
Wonder Woman, yes.
We are Wonder Woman. And so I invite everyone to visit Hope Connections for Cancer Support. And if viewers don't know, we're at 8401 Corporate Drive, Suite 100
so what we're
in
going to
Landover,
do
Maryland.
is we're going to give all of that information at the end of the program, both for Anne Arundel Medical Center and for Hope Connections. And we hope that the outreach, we hope we're reaching the folks that need to be touched by this program.
Thank you, Stephanie. We appreciate it.
We've been talking to Dr. Meghan Milburn, and we've been talking to Jacqueline Beale with Hope Connections. You're with Anne Arundel Medical Center, a breast surgeon, and we're going to conquer this.
We are.
Absolutely. Thank you so much.
Thank you for having us.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.